Thank you, Cathaoirleach. I want to ask the Minister for Health when we will have our detailed roadmap for the reopening of medical services. So we have a roadmap that specifies for social services, for businesses, when they will reopen. So, for example, we know that on the 20th of July that people can go to the hairdresser. But we don't know, for example, when you can get a cervical check or breast check. And when you go to the HSE website, it simply says, breast screening is paused until further notice, will begin again when it is safe to do so. So, in other words, no indication and no prediction of when that will happen. That's what people see. We are encouraging people to attend the hospital to present if they're sick. We're telling people that this is the time to go back. And yet, health professionals don't know when their services should be offered again. And if the health professionals don't know, certainly the patients have even less idea when they should be there. So it is important that we provide that clarity in the same way that that clarity was provided to businesses. So, for example, I've been contacted by several occupational therapists, people who do a mix of public and private occupational speech therapy for children. They're prepared now to reopen with appropriate precautions, but they're unclear on where their services fit into a reopening roadmap. So it's a roadmap that I'm looking for, to avoid the uncertainty and anxiety for them and for their patients. So can you tell me for a start, if you can map the reopening of the various detailed medical services onto the existing roadmap, and if there's a plan to do that?
Smith for raising this matter, and I suppose I should say at the outset, we know that roughly from the middle of March until the 12th of May, the position was that all non-essential health services effectively should be paused. And NEFIT on the 12th of May said from a public health point of view they believed it was now appropriate that you could lift the pausing and replace it with a recommendation in relation to appropriate clinical and operational decision making. And since then, the HSE, led by Paul Reid, have been working on trying to put in place that safe non-COVID care plan. They're doing very good work. I met Paul Reid on this matter either yesterday or the day before. And it is their intention within 2 weeks that they will publish their framework for non-COVID care in Ireland. I outlined on the record of the House earlier, I won't eat into your time by going through it now, but the 8 key principles that they will use in guiding that, and I'm happy to send you a note in relation to that. So within 2 weeks, I expect the HSE to outline to the people of Ireland how they intend in a safe manner to recommence non-COVID health services both in the community and in the hospital setting.
Thank you for that answer, within 2 weeks. The next thing is we're all aware that there are profound implications for mental health from the current pandemic. And yet, as far as I know, the Vision for Change document is 14 years old and really requires to be updated. And I know there have been reports from people like Catherine Day and so on trying to improve mental health strategy. But can the Minister outline to the House where we are on getting an updated mental health strategy from the Vision for Change document, whether that's likely to be published?
So thanks to Deputy Smith, a really important question, and we've all probably met with mental health reform and other organisations in relation to this. We do need a new vision for change. We absolutely need it. My colleague, the Minister of State for Mental Health Services, has been working on this, and there is now a draft new version of Vision for Change. It was considered by a Cabinet Committee, and it is, in my view, ready to go to Government. There is a long-standing position in relation to not bringing forward new policies. There is a view being expressed in this House in recent weeks, which I'm sympathetic to, that despite the political interregnum, political leaders are happy for me to bring it forward. I can't give a commitment on behalf of the Government, but I'm happy to engage with parties in relation to that. The general view is you allow the new Government to bring forward the policy, and we all hope there's one of them soon. But there is a Vision for Change ready to go, and it's just a matter of when we schedule to bring it to Cabinet, whether it's brought by the outgoing Government or the incoming Government in a few weeks' time.
Are you saying the next few weeks then, or roughly?
Yeah, I was going to be funny and say you could answer that, but I won't be because it's a very serious matter. It's a very serious matter, but no, it's ready to go to Government. I mean, there is a long-standing principle that I wouldn't bring forward a new policy on behalf of after an election, but it could be brought by a new Minister for Health on their first or second week in the job.
Okay, I want to move on then to scenario planning. So, in general, I think the simple way of planning for things is that you look at what's likely to happen based on what's happened in the past, and things continue on and they go along a line. But because this is a novel coronavirus, because we don't know exactly what path the disease is going to take, there's a number of different possibilities that have profound implications across different sectors of society. So everything from, will a double-decker bus carry 17 people or 35 people or 50 people? How many people will be able to go into a waiting room for a medical service? So we have very, very different possible outcomes that will have different amounts of money that need to be borrowed and different quantities of service that will be available. And I think it's actually a time when you really need scenario planning, and I would ask the Minister whether he would consider asking for some proper scenario planning to be carried out. I don't know whether it's by econometricians or somebody else.
Yeah, I absolutely will, and indeed I've discussed this with the chair of the HSE board and with the CEO. I mean, I'm very conscious and clear that NEFID advise government from a public health point of view on the COVID pandemic. The running then of the health service obviously falls to the HSE. I've had very good discussions with the HSE in relation to the non-COVID. You can see Deputy Kelly nodding in agreement in relation to the non-COVID care plan. You are right. We need to, I was saying earlier in this House, probably keep our capacity at 80 to 85% bed occupancy in our public health service. That has very serious implications in terms of how you prepare for a winter surge. We also obviously need to look at outpatient clinics. Will we be doing more of them virtually? I'd imagine we will be. We also need to look and see, is this now an opportunity to move some of the outpatient clinics that we've all been talking about for years out from the outpatients and into the community? Could the new community assessment hubs or primary care centres be used in that regard? Could we have allied healthcare professionals leading some of that? So this is the work, I want to assure you, is underway, being led by Dr. Colm Henry, the Chief Clinical Officer of the HSE, and I expect we'll be able to talk about it in detail in a fortnight.
Okay, thank you. Okay, I suppose I can ask about it at the COVID committee. I want to talk about international travel within Europe. So every country has its own roadmap, and part of that is reopening international travel. And every country is coming up with different rules. So there's a lack of symmetry or a lack of reciprocity. You go to one country, you're quarantined, you come back and you're not. And I don't think that makes any sense. So I just want to know, can the Minister update us on any efforts to coordinate that strategy across Europe?